So hi again, I'm Geren, and I'm a licensed acupuncturist. I graduated from UC Berkeley back in 2004. My major was genetics and plant biology. Really loved being here at this school. I took some time off to figure out what I was going to do with myself, and did a bunch of very odd jobs all around. Like I was a beekeeper, and I took care of kids, and I just did whatever struck me to be fun. And during that time, I realized that I really wanted to do medicine, whereas in the past, I didn't want to because it was something my parents wanted me to do. When I was a kid, I was maybe 9 years old, and I was driving down the street with my grandparents. They'd take me to go see a movie, and I saw this acupuncture clinic. And I was like, oh, what's that? That sounds really cool. I would really like to do that. And I didn't even know what it was, but I just knew that I really wanted to do it. And my grandmother, who was the one who kind of wore the pants in that relationship, she, in terms of her and her husband, she was like, oh, that's great, but get your MD first. And that's exactly what my parents told me. My mom had this thing like, oh, I just want you to be happy, but you should get your MD first. My dad was like, no, you should get your MD first. He was really pissed that I didn't go to Harvard for my med school instead of doing Chinese medicine. But because they had pushed me so hard, I rebelled against it. I didn't want them to be the one deciding what I was going to do. This was my life. I had to do what I wanted. And so after those years of not doing anything related to what I thought was going to be my future, I didn't want to do genetics because I didn't like doing lab work. I wanted to work with people more directly. I didn't want to sit behind the glass and plate petri dishes, plate seeds, or whatever. So instead, I took that time, and I finally came back to the realization that I really wanted to study medicine. So I actually decided I was going to do Western medicine. And so I took my MCATs. I did a 3-month crash course study to take my MCATs. Probably one of the more stressful times in my life besides, well, that was probably the most stressful time in my life. And took the boards, got a great grade, applied for med school, got interviews lined up, and right before, about 2 weeks before my first interview, I was like, what am I doing? I'm doing this for all the wrong reasons. I thought that I needed the Western medical degree in order to be able to reach more people, for people to take me more seriously. But I realized that that was just an idea in my brain. An idea I had, and it wasn't necessarily the truth. And why waste 4 years plus residency doing something that I wasn't as interested in when I could study what I really loved? And I had gotten great responses from Chinese medicine in ways where Western medicine was like, here, take antibiotics, here, take this, side effects to this, take this. That didn't even help my condition. It only gave me side effects. So I realized, like, oh, wait, there's got to be something else. So I tried Chinese medicine. Chinese medicine was the thing that actually got me back into harmony. It treated me with herbs. It treated me with acupuncture. They told me how to adjust my lifestyle habits. I had to adjust what I ate, for instance. Our diet is our #1 medicine. We'll get into that. We'll talk about that a little bit later. So I went down the path of studying Chinese medicine, and honestly, I could never be happier, or I couldn't be happier. My father still likes to make little comments here, and he's like, oh, that's great. And he would say, oh, you're chucking spears at people. Ha, ha, ha. And he still was like, oh, you could have gone to Harvard or whatever, even though I don't know if I would have gotten into Harvard. But I did it for me, and I'm so happy. So we're going to talk about, general history of Chinese medicine briefly. We're going to talk about what acupuncture is, what herbal medicine is like, the pros about Chinese medicine, and the limitations of Chinese medicine. Chinese medicine isn't perfect, but it fills a need that Western medicine isn't quite filling. So we're going to talk about that. So putting Chinese medicine into its historical background shows that it is over thousands of years old. It's amazing. It's been around for so long. They did all of this and figured out all these things about the body and the way it works just by observing functions. Chinese medicine and Chinese culture, they didn't believe in cutting open bodies after death because it was disrespectful to the ancestors. So they figured out what the heart does, they figured out what the liver does, all the different organs and what they do without cutting open the body like we do in Western medicine. It was only after Western medicine made it into China that they started doing it. But if you look before the Communist Revolution, the Communist Revolution was like really the time that really changed the scope of Chinese medicine, changed it very dramatically. So before the Communist Revolution, there was many different schools of practice. They all had a lot of similarities, there's a lot of overlap, but they all had lots of differences to them, tons of differences. For instance, there was the Five Elements School. The Five Elements School was all about looking at the different organs as related to different elements, from wood to fire, to earth, to metal, to water, and back to wood again. And all of these different elements are in balance, and you can see them here. So the outer circle on this, at the bottom here, is a generating cycle. They all support each other, right? Fire burns down wood in order to release the nutrients into the earth. From the earth, you dig up metal. From metal, metal perspires and you get fluid from it, making water. And water nourishes wood, right? It gives it the fluid that it needs to grow. And then wood is burned to make fire. But then all of these elements, they also control and keep each other in balance. So they're not just generating each other, but they're keeping them in balance. For instance, wood controls earth. The woods, the roots of the tree, for instance, go into the earth and control it and keep it from getting out of control. Another good example is the water-fire relationship. Water controls fire. That's easy to see. You need to put out a fire, you throw water on it. So all of these things are in balance, and all of these you can diagnose based on looking in these styles, or at this way of looking at this. It's really amazing because you can see where a pattern has the key disharmony. Really cool stuff, which is something we go into in Understanding Chinese Medicine, the public course that we teach at the American College of Traditional Chinese Medicine, if you're interested in learning more about that. Another school was the Pi Wei School, which is the pancreas stomach school. And their whole idea was that if you don't treat the digestive system first, there's no way that the rest of the body can heal. So their whole focus was make sure the digestive system is doing well, make sure it's doing well. If that is healed, then the rest of the body can heal more easily. And those are just two examples of a bunch of different schools. But then the Communist Revolution happened, and what happened at that point was that Mao Zedong and a lot of people said, oh, this Chinese medicine stuff, this is crazy, this is woo, it's nonsense. Look at Western medicine. Western medicine is amazing. It's based on science. And Western medicine is amazing. There's a lot that you can do with Western medicine. But the downfall was, after Mao Zedong banned Chinese medicine and brought in Western medicine to treat people, what happened was that there wasn't enough money to take care of the people because Western medicine is very expensive. So what he did was he said, oh, no, it's okay. Chinese medicine is great. We'll do this. We'll take care of the people. Let's convene our top people and we'll make them all agree on one form of medicine. So whereas in the past, before the Communist Revolution, we had all these different schools, after the Communist Revolution, we have what's called traditional Chinese medicine, where everybody agreed on one system that everybody uses. And this is, for the most part, what's taught now and what you learn in Chinese medicine school. However, there's always classes that will start to give you extras, like classes on 5 elements, classes on all sorts of different stuff, so that you can look at the deeper spiritual aspect of the medicine, which Mao Zedong took out because he wanted the people to be more under control. He took out the spiritual nature of that medicine. Yeah. Any questions on that, or is that clear, that delineation? Yeah. Good. So the different things that we do in Chinese medicine are multifold. The one that's most famous, of course, is acupuncture. When you talk about acupuncture, here on the right side, we have the map of the meridians. Chinese medicine school, you're going to learn almost 400 different acupuncture points. These are points that have different functions and different energetic properties. So you have points that can strengthen the digestive system, points that can strengthen the blood, points that can, what we call, calm the spirit for people who are anxious or stressed, points that move the chi or the energy. There's all sorts of different things you can do with this acupuncture treatment. Of course, the number one thing people think about is pain, but there's so much more, which we'll talk about in a little bit. Then there's herbal medicine. This is a nice little display here on the bottom left of herbal medicine. This one right here is very common. This is goji berries, goji, and that's used for strengthening the blood. Notice that it's red. Right? There's a lot of similarities where things are the color of what it's going to support. Or this is datzao or hongzao, the red dates that they drink in Chinese ceremonial teas, for instance. Yeah, stuff like that. So the acupuncture goes so far, but the next step is really the herbal medicine, because someone will come in, let's say, once during the week for a treatment with acupuncture, but then there's a whole week in between when you see them next, or 2 weeks even. So if you give them herbs, then that treatment can continue throughout the week. But also the herbs treat on a different level. Acupuncture really works primarily on manipulating and supporting the chi or the energy of the body. You can't necessarily add blood into somebody through acupuncture if their blood is deficient, if they're like anemic or if they're on the road to becoming anemic. But the herbal medicine is that physical substance that supports it. The acupuncture can direct the chi to work on building the blood, but it's not going to be adding blood itself. Cupping's really fun. I always love doing it. Are you all familiar with cupping? Have you ever seen that before? Yeah. So cupping is where you take a cup, you literally soak a cotton ball in rubbing alcohol, use forceps to clamp it, light it on fire, stick it inside the cup, pull it out, put it on their skin. When you stuff that burning cotton ball inside the cup, it sucks out all the air, well, it burns out, all the air, and creates a vacuum. So then you put it on their skin, and it sucks that skin up under it. It's really good for musculoskeletal disorders, and you can even, if you put massage cream under it, you can move it, and it becomes a massage. That's really good for treating musculoskeletal disorders. Treats other stuff, such as have anybody had a common cold where they get that big headache in the back? Right? You can do points that are here on the upper back and do cupping there, and literally within 10 minutes that headache is completely gone. So then there's Moxabustion, which is here in the bottom on the middle, and that's the burning of an herb called mugwort, or ye in Chinese. And what that does is it's for people who run cold a lot, for instance. It really is good at warming their constitution, but it really also moves and tonifies the chi, so it strengthens their energy. It's really great. And then another modern thing is electrical stimulation. It's like a TENS unit, but you actually hook up the electrodes to the needles themselves. And that way, instead of sitting there where an acupuncturist will sit there and manipulate the needles to tonify or strengthen or to move the chi, whatever it is, now you can hook up an electrical device that will do that for you, so you're not just sitting there for 10 minutes manipulating the chi. That gets really tired. Okay. Any questions? So talking a little bit more about acupuncture. The needles themselves are really, really fine. They're really small in diameter. People think of, when they think of needles, they usually think of hypodermic needles, right, that are hollow on the inside, used to draw blood. Those are also stuck right into veins. Veins really hurt. They're really innervated. So those needles, yes, they really hurt. Acupuncture needles, for the most part, they don't. The key with it is that you want to get the needle through the surface layer of the skin really quickly. If you can do that, which all trained acupuncturists are good at doing, you get past the innervation on the skin and it doesn't hurt. Yes, sometimes there are points that hurt a little bit, usually when we're treating pain. If someone's in pain, that point is going to be painful when you needle it. But then you're getting them out of pain in general, so isn't that awesome? It's kind of worth it, right? Yeah. So the points, like I said, they're located on meridians or channels of pathway of chi. The channels run on both sides of the body. For instance, the lung channel runs up here into the lung. There's one on the other side. The stomach channel runs here, goes up like this, and then comes back down and goes all the way down to the feet. So there's all these channels. There's 14 of them that have their own points. And they correspond to different organs for the most part. Yeah, I already talked about how we use it to direct the flow of blood and qi, and we treat lots of stuff. So here's just a brief intro to Chinese medicine concepts. Yin and yang. Yin and yang is describing the balance of our bodies. Yin is more the cooling, moist part of our body. Yang is more the warming and dry part of our body. But both of those are always working in combination with each other in balance. Okay? The different organs will have to have those in balance. For instance, if you're talking about the liver, when the liver yin and yang aren't in balance, the way it comes about is, or the way it manifests is yin deficiency, where the yin isn't strong. So there's relatively more yang. Yang being warm, it'll rise up. And what that happens, what that creates is hypertension. People, their face flushes really easily when they get angry or anxious. High blood pressure, all that stuff happens because of this imbalance. Blood is just like the blood that we talk about in Western medicine, though it has more functions in Chinese medicine that we talk about. And then there's qi, which is energy. We've talked about qi for a long time, about all the different philosophical aspects of it. The easiest way to think about it is that it's energy. But that energy is functioning. It's doing stuff. It knows what it needs to do. The closest biomedical aspect to it is you can think of it as ATP, adenosine triphosphate. Right? The quick storage of bonds of energy. Right? High energy phosphate bonds. The way that we improve our energy, of course, is through food. Right? Food is the number one thing that nourishes us. But what we need even more than that to live, not to be nourished, but to live, we need air, we need oxygen. What's the number one thing mitochondria need to make ATP? Oxygen, right? So the more we breathe, the more energy we create. So in Tai Chi and Qigong, in Tai Chi you're doing these slow movements to slow your body down and calm, but you're doing deep breaths. And so that's why in Chinese medicine we're really focusing on slowing the breath, slowing it down, but taking deep breaths, because that's going to improve your health. In Chinese medicine, like I said, without cutting the body open, we have all of these overlaps of organ physiology. However, there are differences. We're not going to go into them now, except I'll give you one. How about that? The heart is what's said to house our consciousness, the spirit of our consciousness. We call it the Shen in Chinese medicine. That's the Chinese name for it. And it's nice, like, think from your heart, right? You hear those sounds. Follow your heart. So what it's said in Chinese medicine is that the consciousness resides in the heart, but during the day it comes up to the brain to animate it. But then at nighttime it comes back down to the heart to rest. And so there's different things you can do. If you have difficulty falling asleep, what I suggest is while you're laying down in bed, taking a deep breath through your nose, exhale through your mouth, and imagine all of your energy going down to your feet. You don't need to move your hands with it if you don't want to. But what you're doing is you're guiding your consciousness to go lower. And once you can guide it to go lower, it can settle into the heart, and then you fall asleep. So a lot of overlap, but a lot of cool differences in the way Chinese medicine looks at the organs' function. The way that we diagnose is we do a lot of intake questions, which is important. Right? We'll ask you, there's what we call the 10 questions, which look at 10 different general categories of things, from sleep to emotions to digestion to thirst, bowel movements, libido. We ask all sorts of stuff. A lot of people are like, why are you, they get a little nervous if it's their first time. They're like, why are you asking me all this stuff? And what I always say is that everything's connected. In Chinese medicine, we're looking at the body as a whole. We're looking at how all of these things interrelate. And that's the beauty of it, right? That's the beauty. We're not just looking at your lung, right? We're not just looking at your heart. We're looking at how everything is working together. We will observe. We will look at the color of your skin. We'll look at the sound, or we'll listen to the sounds of your voice, for instance. That'll tell us a lot. But the two of the most really important is the pulse. So I've been treating an MD, and that MD lives a little bit far away, so he doesn't come to see me as often as he'd like to. And he was like, oh, I want you to re-prescribe those herbs you gave me. I can't do that because I need to do an intake. I need to check your pulse and look at your tongue. I need to do all of that stuff so that I know how you responded, so that I know how I need to change your formula, change your herbal medicine. He says, well, I'm an MD. I can take my pulse. What do you need to know? You're just wanting to know the pulse rate, right? And, you know, I kindly, of course, say, well, there's so much more to that in Chinese medicine. So when we take the pulse, we're looking at the radial pulse, the pulse on the thumb side of the wrist. And there's 3 positions to that. Each of those 3 positions correspond to different organs. We have the lung, we have the digestive system with the pancreas and stomach, we have the kidney, specifically the kidney yang function. On the left side, we have the heart, we have the liver, and we have the kidney yin function. What I always love to do, and people are always like so amazing, it's so fun for me too, is I'll say, don't tell me anything about what's going on with you. Let me just take your pulse. I'll take their pulse and I'll tell them, oh, do you have sleep issues? And I'm like, how did you know that? And that's because I can look at the pulse and see what's going on with different organs and see what's out of balance. I can look at those things and tell you things that are going on. So when we're done, if you want, I'd be happy to take your pulse. The other thing we do is we look at people's tongues. This is the one place where it's encouraged for you to stick your tongue out. When you stick out your tongue, we'll look at the color of the tongue, we'll look at the shape of the tongue, we'll look at the fur on the tongue, the covering on the tongue. A lot of people like to scrape their tongues, and I think it's a good thing. It's good for oral hygiene, it's good for not having bad breath. But what I always tell my patients, and I always ask if they brush their tongue, say, give me a week to 2 weeks where you don't brush it whatsoever. And they're like, oh, really? I'm like, yes, please, please. And so they'll come in, and then I'll see if it's grown. It'll change in volume. I'll see the color of it. I'll see all sorts of things that will tell me something diagnostically. So it's really great. And then I'll say, go ahead, you can scrape it all you want. So just a brief overview of the different diagnostic techniques that we use. When you look at diet in Chinese medicine, here's just some general concepts. In Chinese medicine, we generally like foods to be cooked. And this is because foods that are cooked are easier to digest. Yes, there's the whole raw food movement, right? Everybody's really all about the raw food because raw food has all the enzymes intact, which is true. But what they're not taking into account is, for instance, with vegetables, you have the hard, outer, fibrous part of it that you have to eat and digest, which is really hard to digest. Things that are hard to digest are considered cold on the digestive system. By the way, the nature of antibiotics are that they're very cold. This is why people who take antibiotics too long, they tend to have low appetite, and they tend to not be able to digest food well, because they've dropped a cold bomb on their digestive system. However, you can eat according to the seasons. When it's hotter out, then we encourage more raw food because you need to cool your body down. So salads during the summer are great. Unless you live in San Francisco, it's maybe a different story. All the fun. But in general, summer salad is fine. During the winter, you want to eat more soups, things that are easy to digest, things that are more warming, more ginger, more garlic, more onion. And of course, in Western medicine, we're all about eating so much meat. It's such a big part of our culture. And meat is really great. Chinese medicine does not, for the most part, advocate vegetarian diets. I'm not saying there's anything wrong with a vegetarian diet. But if you aren't eating a proper vegetarian diet that's properly balanced, you can have a lot of easy disharmonies. One field of Chinese medicine that's really popular, and if you ever wanted to go into it, you can make a lot of money doing it, is fertility. And it's so common for fertility patients to come in to see a fertility specialist, and the main reason that they're having fertility issues, a very common one, is that they have a vegetarian diet. Because they're not able to support their blood. If you looked at it from a Western perspective, they're not eating red meat, so they're not getting enough iron. But from a Chinese medicine perspective, it's much bigger than that. The foods to avoid are cold, damp, greasy foods. These all lead to weight gain. Cold foods are, for instance, the uncooked foods, the raw vegetables. But there's also foods that are cold in nature, like watermelon is really cold in nature. Watermelon, during the summer, what do people like to eat? Cool down. A lot of watermelon, right? So watermelon, inherently in its nature, the way our body processes it, it cools us down. Foods that are damp and greasy, when we talk about damp, we talk about like pathological fluids, like deep fried foods, all that stuff is damp in nature. Eating too much sugar leads to dampness in our body. Like I said, pathological fluids. That's a longer explanation. I'm not going to go into it, but hopefully that was enough for you. All of those things lead to weight gain. And that's easy to see. Like damp, greasy food is really fatty, really easily to gain weight on that. But it's so important that we have a happy digestive system. Like I said before, if our digestive system is doing well, then the rest of our body can do well. If your digestive system isn't doing well, no matter how much you treat other stuff, it's going to be a much slower process of healing. So it's really important to focus from that other perspective. Any questions? Okay. Here's a short list of what we can treat. There is so much more to this, but these are like some of the more common ones. Insomnia, pain, menstrual issues, low libido, infertility, stroke recovery. This is one that I really like. I've been trained a lot of extra stuff to do stroke. I did 6 months at CPMC, California Pacific Medical Center, in San Francisco at their rehab unit, working with people who have strokes and traumatic brain injuries. It's a very rewarding field to go into. It's very difficult emotionally because you've seen people who have been hit really hard. But really cool stuff, really cool acupuncture, really great things to do. If you're interested in learning more about acupuncture and stroke recovery, there's a really cool documentary called 9,000 Needles. It's about this guy's journey. He was the epitome of health according to Western medicine. He was a bodybuilder. He like looked so great. But any one of us Chinese medicine practitioners, we would have seen that he was a candidate for stroke. He had that liver yin deficiency with yang rising. He had that hypertension, and we could see it so easily. And he had a hemorrhagic stroke because of that hypertension. You know hemorrhagic stroke? That's when the blood vessels burst in the brain. Really cool documentary. Fatigue, poor digestion, weight loss, emotional issues is another one that I focus on a lot. I do a lot of emotional and spiritual acupuncture for spiritual growth, people growth in their lives, on their life journey. Acne is amazing for it. Facial rejuvenation. I have a friend who specializes in facial rejuvenation. It's called the acupuncture facelift. So you do it along, you can get rid of wrinkles doing this without having to, do all sorts of other stuff. Yeah. This is a nice little British research project that they did. It's small, it's 132 acupuncture patients, so it's not that big of a group, but it shows a lot of the general trends. 75% of the time, these people had their physical symptoms relieved. Very common. Emotional and mental symptoms, 67% of the time relieved. Again, not common, or not uncommon. 54% felt inner life changes, where something really changed for them. It was really transformational. That is beautiful when that happens. When you see that in a patient, their whole life changes, and it's just so amazing. 27% experience major life changes. That's where like things really, really, really changed. This last one is what's really interesting. 42% of the patients change their reason for coming at some point during the course of their treatment. That's because most people think, oh, acupuncture, it's great for pain, and that's it. They'll come in, and we'll talk to them, and we'll find out, oh, why do you have pain? Just because you have pain, it's like an easy diagnosis, but the reason why you're not recovering from that pain is so much deeper. And so we start asking them about different things going on in their life, and they'll be like, yeah, you helped me so much with the pain, but I've been having trouble sleeping. Is there anything you can do for that? I'm like, well, yeah, of course. So there's so much more, and it's so great, and that's the beauty of it, and that's why I like teaching, because we're increasing awareness of what we can really do. Some misconceptions about acupuncture. One, it's painful. Most of the time, it's not. There are some points that can be painful, but we don't have to use those points. Or if we're using those points, it's because it's a real serious condition. For instance, there's someone who had a stroke. There's a point right here, right underneath the nose on the philtrum, that we needle. Very painful. But someone who has facial paralysis, 99% of the time, they will say, of course. Why? Of course, please do that. And I'll needle that point and it hurts. But guess what? We're opening their face. We're getting rid of the paralysis. Okay? So it's worth it. Another misconception is that it is expensive. Excuse me. There are community clinics where you'll sit around in a room and you'll sit in a chair with other people and they'll do like a quick intake and then they'll put needles. There's auricular acupuncture where they put needles into the outer ear in here, which works really well. And they'll treat you like that, and that's one way to keep costs low because they can treat many people at once. There are school clinics, L.Ac TCM, the American College of Traditional Chinese Medicine, has a school clinic that's low fee, where you'll get treated by students who are supervised by licensed acupuncturists. So that's another way to keep it low. As we know, it's completely changing in terms of the insurance world. Under the Affordable Health Care Act, or Obamacare, acupuncture is now considered an essential health benefit. The changes haven't been implemented yet, but what that means is as we move forward, all health insurance companies are going to be required to cover acupuncture. Yeah, really amazing. It's a huge time for growth in our profession. Last thing is that herbs are difficult to prepare and or are unsavory. It's true, a lot of the times they don't taste so great, but here's what I always say. If you want the easy, quick fix, go ahead and take a pharmaceutical. But what are you doing? You're only treating the symptom. You're not treating the real cause of it. You're only masking what's really going on underneath. If you want to really treat what's going on, do the herbal medicine, deal with something that doesn't taste so good. It's okay. Drink it, have a bad taste in your mouth for a second, then have a piece of chocolate. Right? That's what my first acupuncturist said. She gave me the most bitter herb in all of Chinese medicine. Tasted awful, but she was this sort of Chinese grandma. She was great, and she's like, it's okay, just have chocolate, take a bite, and it was so good, and it made the chocolate just coat your mouth. It's great. So there's ways around it. The other way around it is that we have padded pills. We have pills that are pre-made. They're not as strong as cooking a raw herb tea, but they work really well. In between, in terms of strength, there's powdered formulas, where instead of sitting there taking raw herbs and putting it into a pot and cooking it with water to make a tea, you have powders that are pre-cooked and then they dehydrate. So you just spoon out your dosage, mix it with hot water, and mix it up and drink it. So that's not as difficult to do. Limitations of traditional Chinese medicine. One of them is infectious diseases. Right? If you have a serious infectious disease, you need antibiotics. You need to do something more serious about it. Okay? Chinese medicine, surgery, sorry, we can't help you there. And emergency medicine. Of course, emergency medicine and surgery are two of the things where Western medicine is so strong and so useful. If you need stitches, you're not going to come to your acupuncturist. You may have a needle, but we don't know how to suture it. Those are the limitations. The strong suits of Chinese medicine or traditional Chinese medicine. One is that it's preventative. We see the symptoms before they become more serious. It's amazing. We see when the blood is starting to get deficient before it becomes anemia. It's really amazing that we see these. We see these imbalances. And there's so many things that we see. And that's why there's that saying, oh, I can't forget. What's this? I'm so bad with sayings. An ounce of prevention is worth a pound of cure. Is that it? Yeah, okay. But you guys get it. And like I already said, we're an alternative to pharmaceuticals, which is amazing. So many people are getting more and more sick of the side effects. You'll see the commercials and it's like, side effects are stroke and possibly death. You know, it's crazy. And with Chinese medicine, when it's applied properly, there are no unwanted side effects. Really great. Yeah. So what is the future? China embraced Western medicine, but they didn't forget their roots. They didn't forget where they came from, thankfully. So now what they do in China is they've integrated both together. So let's say you go into the emergency room and you need an IV. They'll give you an IV, but they'll also give you an herbal extract that will go into that IV. So they've combined it, or they'll have acupuncture. In Korea, the first thing that they do for treatment of cancer is acupuncture. Right? You have to treat the mind, you have to treat the body, get things flowing properly before you can go down the road of doing other things for treating cancer. Yeah. Okay. So here are some resources if you're interested. If you want to read a book, The Web That Has No Weaver is a good introduction, or Between Heaven and Earth. There's the American College of Traditional Chinese Medicine. That's a local school. I'm very partial to it. We are considered the best in the state, if not the country. We're in the top. We're really amazing. We have the most graduates who make the most successful practices for themselves. And we have one of the highest pass rates on all of our board exams, which is fantastic. There is AIMC in Berkeley, which is close by if you guys want an easy place to get treatment. But if you contact our admissions office, and Megan's here too if you guys want to talk to her, in case she has to go before you leave, hopefully, if that can happen. A lot of times we'll give free treatments at our clinic. We'll give a free, come in and give us a try.
I would say, I have to go in a couple of minutes, if you want more information about our school, just put your email down on the sign sheet. Or you already get them, but if you want to be added to our subscription. I write them.
Yeah, so that's that. So if you guys have any questions, I'm here for you. If you want me to take your pulse, I'm happy to. Yeah, I'm here. Thanks for coming.
Yeah, that's great.